The story I hear in my office almost every day isn't about not getting an erection. It's about a man who gets one just fine, but it all ends too quickly. Maybe you can't last longer than a couple of minutes, or even seconds. You know that anxiety, that pressure, that frustration. You try to control it, but your body just won't listen. You're not broken, and you're definitely not alone. This is one of the most common and most fixable men's health issues I treat. Today, I'll explain why this happens and give you 3 practical methods you can start tonight to take back control. No pills, no gimmicks. Understanding the root cause. Before we fix it, we need to understand it. Premature ejaculation isn't usually a physical defect. It's a neurological and behavioral pattern. Think of your sexual response like a superhighway. When everything's balanced, the signals of arousal move at a normal, controlled speed. But with PE, it's like the on-ramp to climax is way too short, the signal fires too fast, and you don't have time to react. 3 major drivers cause this. Anxiety and pressure. The more you worry, the faster it happens. Your brain floods your body with adrenaline, a stress chemical that literally pushes you over the edge faster. Silence and shame. Avoiding the topic with your partner builds tension and turns intimacy into performance. That fear of failure makes the body tense, which speeds things up even more. Early habit formation. Many men train their bodies to finish fast in adolescence. A quick and quiet mindset that hardwires your nerves to respond too quickly later in life. But here's the good news. You can absolutely retrain your body and nervous system. Just like learning to play an instrument or build muscle, you can teach your body to slow down. The stop-start method. The first and most effective technique is the stop-start method. This technique retrains your nervous system by building tolerance and awareness. It's best practiced with a supportive partner. Here's how it works. During intimacy, when you feel yourself getting close to climax, stop all stimulation immediately. Take a deep breath. Shift your focus away. Think about something mundane like your grocery list or your last work task. Allow the intense sensation to fade. Once that urge subsides, you can start again. Repeat this cycle several times. Start, stop, start, stop. Over time, you'll learn to recognize the exact point of no return. You'll build a neurological delay that gives you control again. The key is communication. Let your partner know what you're doing, so they understand it's not rejection. It's teamwork. Many couples find that it actually increases trust and intimacy. The squeeze technique. The second tool is the squeeze method. This one gives you a quick physical reset when you're close to finishing. When you feel like you're on the edge, either you or your partner should firmly squeeze the area where the head meets the shaft. Not painfully, but firmly enough to slightly reduce sensation. Hold for 5 to 10 seconds, then release. This sends an immediate physical signal that interrupts the ejaculatory reflex. It's like hitting the pause button on your nervous system. Once the urge passes, you can resume at a slower pace. Combined with the stop-start method, this creates both a mental and physical control system, giving you command over your body's rhythm. The pelvic floor fix. Your third and final tool is strengthening your pelvic floor muscles. These are the same muscles you use to stop urine midstream, and they play a critical role in ejaculation control. When these muscles are weak, it's like having a car with soft brakes, you just can't stop in time. Here's how to strengthen them. Identify the muscle by stopping your urine midstream. That's your pelvic floor. Contract that muscle and hold for 5 to 10 seconds. Release completely. Do this 10 to 15 times, 2 or 3 times a day. You can do them anywhere. In your car, at your desk, or while watching TV. With time, you'll be able to activate those muscles during sex to delay ejaculation. It's a built-in control mechanism you can engage instantly, bringing it all together. Gentlemen, this isn't about perfection. It's about progress. These 3 tools, stop, start, squeeze, and pelvic floor control, work best when combined with honesty, patience, and communication. Remember, this is not about lasting forever. It's about confidence and control. You're retraining your body to move at your pace, not anxiety's pace. And if nothing changes after consistent effort, don't ignore it. Sometimes PE can be linked to underlying issues like hormonal imbalance, prostate inflammation, or thyroid dysfunction. That's when a simple doctor's visit can make all the difference. Premature ejaculation isn't a flaw. It's a habit that your body can unlearn. Start tonight. Practice the stop-start method. Use the squeeze technique. Strengthen your pelvic floor every day. With consistency, you'll rebuild confidence, control, and connection. If this video helped you, give it a like and subscribe for more real medical advice. And tell me in the comments, what's one topic you'd like me to cover next? I'm Dr. Zoe Hartley. Stay well, and I'll see you in the next.